Well, one of the biggest questions Americans are asking on health care reform is how are we going to pay for it? One of the leading plans in the Senate says, let's tax health care benefits. Well, that got the unions very upset, and unions vote. Hence the new plan, tax health care benefits for everyone but the unions. Is that fair? Pennsylvania Congressman Joe Sestak is a Democrat and a member of the Small Business Committee. He joins us with his thoughts. Congressman, good morning to you.
Good to see you, Megyn.
All right, so in defense of you, this happened over in the Senate. You don't have your fingerprints on this one, but you're a Democrat and you're a lawmaker, and you'll have the chance perhaps to vote on this because it's gaining some momentum over there in the Senate. This is Max Baucus's plan. He wanted to pay for it by taxing health care benefits. Then, of course, the unions complained. Now we got the new and improved plan. I can't tell you the number of emails we got on this yesterday from non-union members saying, huh?
Megyn, look, there is a reason why the unions who make collective bargaining agreements that go out for years have an understandable case to make. But I have to say this. If this plan is not in reality and even in perception fair to everyone, it's going to die on arrival. And so I believe that we need to make this exemption possible for everyone. If we need until 2013 for the unions, we should make it the same exemption for others. And I think that's very important. But the overarching point, Megyn, is this. You're paying for the 47 million uninsured anyway. It's costing you as an individual, or if you are a spouse with 2 children, $1,100 more a year, as an individual, $400. All we're trying to do is make the cost of this not be indirect, where you're paying it on your private health care insurance to cover the uninsured, but to bring them into the system and be overt about it and say, here's how we're going to pay for them, and then by covering them, we can save money.
I don't think people understand. Well, how is it that people who have health insurance right now are paying for the uninsured already?
Absolutely. A hospital gets some money for the uninsured when they come to the emergency room from the government, but not enough, and they have to eat the rest. So they turn to the insurance companies and say, when I give you a bill for those that are covered, your cost is going to be more. The insurance company turns around to you, Megyn, and says, here is what you're going to pay. That's why health premiums have gone up 86% over the last 8 years in Pennsylvania, but wages have only gone up 13%. So, Megyn, the real issue, and the Democrats are not making this argument, and they should, that you're paying for it anyway.
Let me ask you about the numbers.
We just need to be upfront about that.
I hate math, Congressman, but let me help you, or get you to help me do a little bit of it. Because, you know, they're putting the cost on these health care reform plans any place between $1 trillion, maybe $1.5 trillion. No one knows for sure right now, but they're big numbers. So is that number bigger than the number it's costing us to pay for the uninsured, according to you already?
You know, I should have done that math before I spoke to you, but it should be roughly equivalent and less, actually, than the cost, because once you bring in the 47 million, instead of the individual who has diabetes but doesn't go for preventive care, waits till they go to the emergency room, we amputate their leg, and then we pay for the aftercare, the wheelchair, and all the handicap efforts that need to take care of that gentleman or gentlewoman. So in the longer term, the cost outside is more. And that's why we also have to change Medicare and Medicaid. Right now, we do fee-for-service. It's how many visits that a doctor gets reimbursed upon. You come in, you're sick, he fixes you. The incentive is not there to say, we're going to pay you on the quality of the care of that individual.
The incentive is on volume.
That if you make sure... You got it. And so that's what we have to do. Now, I don't believe that we should be taxing, in a perfect world, employer-based health benefits. President Obama had it right, I believe, at the beginning. He said, look, over the past 8 years, and you can agree or disagree with the philosophy, but not the facts, over 50% of the tax benefits went to the more affluent. So he said, look, let's go back to the Reagan year when your max deduction on your income tax could be 28%. Let's just go back to what Ronald Reagan liked. That was his proposal. Now, the Congress is going to this and going to that because we don't want to stand up front and say, good plan, fair plan.
Understood.
And so, therefore, you have it on who taxes what. We should have taken the president's plan.
Congressman, I appreciate you coming on and giving it to us straight, and I appreciate your honesty on the union issue, and we'll we'll expect you to be voting against that, I guess, if you, according to what you said today. But listen, I know you had a daughter who suffered with cancer. You served this nation long and hard as in the U.S. Navy, I believe, and you're fighting hard for what you believe in, and we applaud you for that.
And Megyn, if I could, and I don't want to take over time, but I'm wearing this today. I just came from a big rally that established a pediatric cancer caucus, because as I was down the road in Children's Hospital and she had a brain tumor, in the bed next to her was a young boy, 2.5 years old, with acute leukemia that did not have health insurance. Social workers came and went. They kept him in that hospital, and you and I paid for that. And so that's why I want to get
hasn't been
coverage
discussed
for all.
that much. You're right about that, Congressman, and thanks for coming on. We hope you come back.
Thank you very much.
All the best.
All right.